Hey, I want to talk about Lecanemab, one of the drugs that's FDA approved to use for Alzheimer's dementia, and I'll talk about donanemab in another video, but I wanted to explain the mechanisms of how these drugs clear amyloid. So the theory behind Alzheimer's dementia is that we form these amyloid plaques, and these plaques prevent communication of our neurons with each other. But everybody forms amyloid. It's just once this amyloid protein starts to misfold and become plaques that communication in the brain is disrupted. So imagine this glass of water. It's a clean brain and produces amyloid, clears the amyloid. And now we have these protofibrils. This is like pre-amyloid plaque. So this is soft stuff. And so when this accumulates in the brain, it obviously already interrupts communication, and we think that it's really neurotoxic. And then think about hard plaque, so mature plaque, this rock goes into the brain. And so this is a brain of someone who has Alzheimer's. There are protofibrils, these pre-plaques, and then also this big mature plaque. So what Lecanemab or Leqembi does is it clears both the mature, but it really targets the protofibrils, because the theory behind that drug is that the protofibrils may be more neurotoxic. And that's also the other reason that once the amyloid has been cleared, and we can see in PET scans on studies that almost everyone clears amyloid, but the drug doesn't have a stop date. You continue to use it on a maintenance dose because it continues to clear these protofibrils. And I see benefit from both medications, but I really wanted to help my patients and anyone who's interested understand the mechanism of how these drugs work. So stay tuned for part 2, where I discuss more about Kisunla or donanemab.